Oh, there you are. Okay, perfect. How are you?
I'm doing well. I'm so happy to be here.
Well, yeah, we're so happy to have you here today. Thanks for taking time out of your busy schedule to join us on Social Impact Live. I'm looking at the chat box, and we have our audience kind of let us know where they're tuning in from, so to speak. And we've got people from Oakland, Princeton, Hudson Valley, Jamaica, New York, Queens, Haiti. Wow. All right. So we'll get started pretty soon with the program. And I just want to note that, we've just passed the 1-year anniversary, right, since the start of the lockdown, right? And difficult to speak to all that's happened since then. But I think maybe this is a time that we can just mark the moment with a shared moment of silence, if that's okay. Okay. All right. Thanks very much. And thanks to everyone who's tuning in today and later to this program of Social Impact Live. Okay. Welcome, everyone. I'm Richard Hara, your host of Social Impact Live, a weekly conversation with members of the Columbia School of Social Work community. I'm pleased to welcome to the program today Kimberly Jocelyn, who is a senior management consultant for the New York City Health and Hospitals Corporation, formerly worked for the CDC as a public health analyst, but most importantly is a 2019 graduate of our program. So Kimberly, welcome to Social Impact Live.
I'm happy to be here.
We're going to be talking about your experience sort of working at the front lines, right, of this pandemic, both, for the CDC and also New York City Health and Hospitals Corporation. You've been a project manager involved with the, what's the name of the tracing program? Contact and Trace, I'm sorry, is that?
The New York City COVID response initiative is called the New York City Test and Trace Corps.
Trace Corps. Okay, and now sort of transitioning into a new role that focuses more on vaccine access. Is that correct?
Yes, that is correct. It's collaborating with the community-based organizations to provide access to vaccines and help with the scheduling process so individuals can be vaccinated and kind of eliminate a possible barrier as having to utilize the internet to schedule individuals.
Okay, yeah. So you've been kind of at the center of it all since the beginning, and can speak to what that's been like. I think for us as a city, right, and for city agencies to respond to the pandemic, but also as an individual and as a social worker. So can't wait to hear more about your thoughts and insights on this. Before we do, I was wondering, always ask our guests to give us a little bit of background on how you got into social work, and I mean, what was the impetus and what got you into your current line of work?
Yes, so it was my undergrad experience. I received a BA from the College St. Elizabeth, which was then a women's college in sociology, and with a concentration in social work. And I had an incredible experience with my professors, and which they provided me a bit more insight as to what social work is. It isn't just casework, because even in undergrad, I was doing grant reviews. So working with collaboratively with one-on-one with professors and getting that hands-on experience outside of just casework, and just and so that's what then allowed me to really just what paved the path for me to go into social work and working on not only a policy level but really making an impact within the community. And it's just something that I'm extremely passionate about. And to be able to work within this line of work in the COVID response and to directly address social justice issues and kind of creating some sort of possible hope to be manual, because I truly believe in the mission of the corporation, of the institution that I work for, and just kind of developing that to change, to just create change, and also really just provide some sort of resource and really do some sort of like serious impact within the community is why I really got into social work.
And I should note here that you were also in a dual degree program, right, at the School of Social Work. So you also got your MPH, yes, from in public health at the same time. Was that something that attracted you to coming to Columbia, or did you have the public health interest, sort of already in place?
I think I always had the public health interest in the back of my mind, but I wasn't necessarily so sure of what it actually was. But it wasn't until Admitted Students Day where I connected with students who were admitted to the dual degree program and really got to learn about their experience and their paths, and also really looking into the opportunities that Columbia provides for students that are interested in a dual degree program or also cross-registering. So that really piqued my interest and really allowed me to really look into not only public health, but also other opportunities that are available. And I love the way that I'm able to combine public health and social work together to really make a huge impact in the community.
Okay, well, I'm looking forward to hearing more about how you do combine the two and what their, respective contributions might be to your aims, right, with regard to community empowerment and social justice. So, so walk me through the process. You've graduated from the School of Social Work. Did you go straight into what kind of work did you go into right after graduation?
I took some time off.
Okay, good for you.
I took some time off, but I also did some sort of, I also still remained in connection with the UN
Mm.
and learned a lot and was part of really important meetings, which I was greatly appreciative of, even post my internship.
Mm-hmm.
So I was still in connect and still in contact with folks at the UN, receiving mentorship and also learning how I can possibly make a global impact. But it's when I noticed that, with everything that's going on with COVID, I wanted to make an impact in any way that I can, and got involved as a federal contractor with the CDC. And which I was able to have the one-on-one provide information on how to protect themselves, and if they're experiencing symptoms, providing them with those necessary resources to connect them with the Department of Health. And then, so I really appreciate that. It's as I was as a screener, just taking the temperatures really at in March, really at the heart of the pandemic at the beginning, and then I then noticed the larger impact, how negatively this virus was really impacting just the overall world, and saw what Cuomo was speaking about on CNN is like, this is the initiative that it will be put in place, contact tracing, and saw that would be an incredible opportunity to not only utilize my social work skills, but also my public health skills. And when using my social work skills, I was able to utilize everything from program planning, proposal, as well as developing policies, but also and also supervising, building and mentoring that connection with individuals so that they can, so I'm just training them to learn how to speak with individuals that are impacted, and also not necessarily taking things personal when they have had difficult calls, but also actively listening to not only direct reports, but also actively and reflectively listening to individuals that were affected by the virus and being of support to them during the difficult times. It was just a huge loss. It's just it was a huge disruption. It's just being of support in any way that I can. And that was everything to me. So it was everything that I've learned, not only academically, but also my professional experience to be able to make that impact.
Yeah, I think, obviously contact tracing was an essential component, right, of trying to mitigate the spread of COVID. And I don't, I mean, can you give me a picture of exactly how it worked? I mean, for you and in your role, I mean, were you contacted by healthcare providers or individuals about positive tests and then had to sort of track down or trace the people that people who had tested positive were in contact with? How did it all work?
Yeah, so at first we received wonderful training to be able to training on what the virus is, the history of the virus, as well as how to conduct calls. And then being able, as a supervisor, being able to first take on those calls and kind of get a feel of what it's like, and also getting to be able to hear about what the actual needs are of the community. In addition to that, it was then training a team of newly onboarding individuals on how to utilize the system, but also being able to train them on how to conduct calls as well. And then the information that we received was directly from the Department of Health. We received the results, and so that went into our queues, and then we would connect with those individuals that were impacted or cases that were affected by the virus, and then we would ask them for their contacts, anyone who's come in close contact with them for a certain amount of period of time. And then we would obtain that information and then also just monitor them and provide resources. So it's not only just testing and tracing, it's also take care. It's providing mental health services, providing services for them to speak with a provider, medical professional, but it's also providing resources for them to safely separate at home, but also there are resources available for them to also safely separate in a hotel. So so that was the entire process, is receiving the information of those who are cases in contact, and then kind of it's in some way snowballing, just kind of connecting with those individuals that were contacted and connecting with them so that we can really stop the chain of transmission. So just providing people with their status, and also providing them with resources, and also building a connection and also trust within the community, which was extremely rewarding and also a great experience.
Yeah, I'm just curious what the reaction of people was like. Who were contacted by contact tracers and so on. What were those conversations like?
It varied because there are individuals who, especially in May, it was such a confusing time. Not knowing about the virus, not knowing who we are, especially New York City's calling you to obtain information. Who are you? Why are you calling me? I don't want to be contacted.
Right.
It's having those difficult conversations, but it's really meeting them where they are. It's providing them with that space to not only explore that, but to deliver that to us who are hearing them. It's really listening to what their needs are, immediate needs, and also providing them with appropriate and accurate information about the virus and how to protect themselves. But those were some really difficult conversations, especially when it's building trust, letting them know that we're not here to cause additional stress. This is a confusing time. If folks experience they were grieving, it's a huge loss, a huge disruption. So it's really meeting them where they are, connecting with them, providing them with those resources, and I say to kind of like us, these kind of issues kind of solve themselves because folks, because they've had great experiences with contact tracers, it led to other individuals knowing more about contact tracers and also being more willing to answer those calls and providing and accepting resources as well. So just knowing that we were there to hear them and also support them throughout their entire process.
Well, I can just imagine what it would be like to get a phone call, informing you that you've been exposed to a potentially life-threatening illness, right? And how difficult that conversation must be. I mean, how long would a typical call be? If you have a sense of that. Maybe there's no such thing as a typical call, and it varies obviously according to individual needs. But I mean, it sounds like this would require an extended period of time to just work through all of these issues that you've just alluded to.
Yes, sometimes the call can last up to 30 minutes to sometimes 50 minutes at that time. And there's also a script. So it's also reading the script and providing the information off the script, but also listening to what's being said and also what's not necessarily being said. Really just taking a step back and not necessarily assuming what the needs are. So it's providing that space. Silence is okay. Providing them that space to sit with their thoughts and just being of support. And if they weren't ready to discuss what they were experiencing at that time, either their symptoms or how they were feeling and whether or not they needed resources, it's always letting them know that even if you don't want to continue this call right now, we're always available to you. These are our hours. So that was just, so it's just being available and providing access to services and also just overall support. But those calls were difficult.
Well, as a social worker and, sort of a supervisor and manager, obviously, your social work skills of engagement and so on come in handy both in the direct work that you're doing and also in the training of staff. With regard to people who were on your team, did they come from a sort of that kind of background, counseling and stuff like, or was it very varied? I mean, people who volunteered and so on. Did they have that kind of I don't know, those kinds of soft skills to begin with, or was that something that you really had to develop in them as part of their training?
I think a lot of individuals came already with the soft skills, but also the passion to make a difference, to support individuals that are affected by the virus. But I'm sorry, I was reading the question and said, can you please repeat the part? I'm so sorry about that, but I think you mentioned, I'm sorry, can you please repeat that? I don't want to.
Yeah, no, I mean, I'm sure not everybody on your team has a social work degree. So, so was that, I mean, did you find it difficult training, or as you were just saying, I mean, most people come with that, I guess, previous helping kind of mentality and so on. So maybe it's not that. I'm just curious, as a supervisor and trainer, what were some of the challenges, right, of that role?
So everyone, what I really appreciate is that a lot of folks came from New York City, so they're very well aware of the community and was impacted. And to have folks come from New York City, knowing, you're in your homes providing assistance, but it's also, this person can also be your neighbor or whomever. It's like really providing that communal support. And all individuals came from all sorts of professional backgrounds, which was incredible because that really allowed for innovative solutions in the process of developing the initiative as well. So if we see, I think the best thing is it's finding solutions and how we can improve on as we go along. And I think that was just incredible. So there were medical professionals, public health, social workers, nurses, doctors on the team, which I think is incredible. There were also other professionals as well, folks that come from an economics background, folks. So it varied. Folks that come from an opera musician background or whatever. But I think it's just that passion really drives passion, and also collaboration really drives great results.
Well, and I imagine that this experience now is informing your current effort, right, to roll out vaccines to across the city to different neighborhoods that might have issues with access, underservice, and so on, historically within the healthcare system. So, so how is that going? Have you been able to sort of learn from past experience with tracing and now doing that outreach to communities for rolling out the vaccine? What is the city doing to ensure that this is going to be as equitable and as efficient as possible?
Yeah, so the city is doing so much to address these issues. And specifically in my role, I'll be connecting and collaborating with community-based organizations to provide access. So if that means helping an organization schedule someone, so it's really getting into the why aren't people signing up? Why aren't they going to getting their first dose? Or why are they getting to their appointments? Is really getting to that root issue and collaborating with trusted resources in the community to provide access in places where individuals may not have thought to provide access. So it's providing access to individuals who are homebound. It's connecting with communities and also communities who have also CBOs that also experience loss, but also helping community-based organizations recover as well. So the city is doing so much to meet individuals not only where they are emotionally, but also physically as well.
So it sounds like this is a real-time data and analytics kind of project, while at the same time sort of trying to implement a whole distribution program, right, for the vaccine as well. So yeah, we've got questions already in the chat box, and I said I would try to bring them earlier rather than later, but here it is, 12:22. So yeah. I'll take the second question first. What ways were you successful in getting people to open up to you via the phone calls? Is there a particular thing that I don't want to say a thing, but I mean, what facilitates that kind of sort of engagement and building trust with these people that are being sort of cold called, right?
Yeah, it's something that's extremely hard, being able to build that connection and trust through phone call and not through a face-to-face interaction. But I think tone really sets a lot in the way it's being used. And speaking, what I truly appreciate about this initiative is that there are tracers that speak multiple, about 40 languages, and there's also a language line. So whatever barriers there are, it's addressing those barriers, but it's also being very open and listening. Listening is key. Listening to what's being said, what's not being said, and also what the needs are, and how we can, within our means, address those needs. So it's that tone, connecting, knowing who your audience is, and if someone isn't ready to speak now, it's like not taking it personal and saying, okay, it's okay, we're available to you, and here's our number, and you can give us a call at any time, and someone may reach out to you just to monitor and just to check and see if you're okay, or if you need any resources throughout your infectious period. So it's definitely that connection, but it's also continuously learning, finding resources that are available online, and connecting with former professors, which I have done. It's like, and I've had great mentors and supervisors and individuals that have worked within the HIV and also Ebola crisis. So, or response. So, really just connecting and listening, which is so important, and setting that right tone.
Another question we've got from the audience: does New York City face unique challenges in vaccine distribution? How does the city compare to other places in the US on this aspect of the pandemic response? From your vantage point, I mean, are there unique challenges here in New York City? I mean, based on size, diversity. I don't know. What are your thoughts?
I think there are unique challenges for vaccine distribution, but I think that we're doing a really great job to address that. I think what the city is doing is great to really invest in the community, and also I don't think this response will address these racial social justice issues all at once. I think what the city is doing is creating a model to really address, or start that process to really address it, where I think individuals can possibly follow after. Because to provide individuals throughout the responses, providing food distribution or whatever it may be to really meet those needs, and now to even provide to go to individuals to provide vaccine distribution to individuals who are homebound. I think is just incredible. If you're unable to, if there's a barrier, it will resolve that barrier. We'll create some sort of solution, and it's working with such a diverse team from all different backgrounds to really create those innovative solutions to address these unique challenges. So if it's a language barrier, creating education and providing additional education in multiple languages. So it's like knowing your audience, knowing your community, because New York City is such a diverse city. So it's being able to connect with all communities, and really having people from those communities as well address these issues, which I think is what the city is doing, and it's incredible.
Yeah, there's a question here. How is the city reaching out to people who don't have internet to schedule them for vaccines? So I don't know if it's the outreach or just contacting a provider, right, to get the vaccine. I assume that there's some sort of telephone helpline, right, as well, or do this community-based organizations help with that as well? On a face-to-face basis.
Yeah, so I'm very new to the vaccine world, so I just want to say that. But there is a phone number, and I can provide those resources after this call. There is a phone number, I believe, is 877 vax for New York City. So individuals who are unable to access it online, and the CBOs will also be able to help schedule these appointments as well. And there are individuals that are canvassing the neighborhoods for outreach. And also there are pamphlets, individuals, because I have received my own vaccine information in the mail from the Department of Health and Mental Hygiene about how to access vaccine, just providing accurate information on vaccines. So there's so many different outreach initiatives that are out there.
This is well, I wouldn't say a change of focus here, but interesting question from the audience. Knowing that you and your team may have been in contact with critically ill people, what supports were in place for your own experience of grief, fatigue, or secondary trauma? I'm curious. Was there that kind of support? Certainly in your role as a supervisor, what was necessary, to sort of help support staff in this regard?
Yeah, New York City Health and Hospitals is doing a great job to really support individuals throughout this process, because it's a huge loss, and it has impacted every individual in a very unique way. So there's mental health services, individuals like I say take a break. If you've got, especially if individuals had just gotten off of a difficult call, is debriefing, taking that break, and just stepping away for a little bit, getting a breather, and taking time off, which is extremely important. So it's like, this organization is, I believe is like, things are still going to run, but we need you to take care so that, that shows in your work, which is extremely important.
Yeah, and I don't know. I mean, this seems to be an issue that we're going to have to deal with for quite a number of years, right? I mean, it's still ongoing, and we're going to feel the effects of this, sort of collective trauma, if you will, right, for a while to come. So certainly, it's a conversation that we need to pursue. I think we're running short of time, so there's a question here, and maybe this will be an opportunity to sort of wind things up. It's been 1 year since New York City became the epicenter of the coronavirus in the United States, and you, Kimberly, have been with us every step of the way in our recovery. Thank you so much for your work. Question. Are there any moments from your work that stand out for you from the past year? Any memories, perhaps of conversations you had with people affected by the virus that you'll always carry with you? I know there are, often these things that just kind of stick with us. So, what stays? What do you think will stay with you?
What stays with me, it's never feeling alone while at work. It's that collaboration. I truly appreciate that, but it's also those stories kind of sit with me when an individual is hesitant to provide information, and overcoming that together, so that they believe in themselves, that they can safely separate, because there's so many concerns as they're providers for their families, and it's like, well, I can't just take off work. I'm a provider, but you've got to take care, and not to kind of not spread it throughout the home, because it's also a common cause of spreading the virus. But so those things will sit with me, is just overcoming those difficult conversations, and knowing that someone went through the process of safely isolating, and it's just building that connection. So it's starting off with a difficult conversation with mistrust, to staying on the phone a bit longer, and building that trust along the way with that individual. Those really sit with me still. It's because it's a huge accomplishment. It's really rewarding. And also mentoring former direct reports as well. That's extremely rewarding, and just kind of letting them know the ins and outs, and just sharing my experience and wisdom, but also learning from them, which has been extremely rewarding, because we all come from different professional backgrounds. So that's also been rewarding. I know I listed a ton, but there's just been so many. I love the team, and I'm so happy to be part of this initiative. And
in the midst of this tragedy, it's important for us to take that time to acknowledge, everyone's contributions and the gratitude that we all feel for them. There's one last question, and just asking, is New York City still hiring for positions in the COVID-19 response? And do you have any resources that you can post about job openings, or actually any resources at all for anybody who's interested, sort of volunteering or contributing to the New York City COVID response?
Yes, I believe there may be open positions that are available on the New York City Health and Hospitals Careers website. Just Googling that. And I can also share a few here if I can get this to open. I'm sorry about that.
Well, you don't need to post it now. We can certainly add it to the chat box on Facebook Live or on YouTube when we upload the video later. But yeah, I think that'll at least provide a first step for people who are interested in looking up those kinds of resources. So Kimberly Jocelyn, thank you again for joining us here today at Social Impact Live.
Thank you for having me. It's been a pleasure. Thank you for joining.
Yeah, no, thank you for your work, and good luck as it moves forward, and hope to hear from you again or have you on our program to give us an update as things go on. So thanks again.
Thank you so much.
All right, that concludes our program for this week. Next week, we've got Mattia Marquardt and Johanna Baez here to talk about trauma-informed online teaching. So until then, take care, be well. See you next time.